Over the years, Professor Chen Hailin has plunged into the vast sea of Chinese medicine classics, deeply studying the characteristics and compatibility secrets of Chinese medicine. In countless rigorous experiments and rich and diverse clinical practices, he has always had a strong desire to explore the unknown, constantly trying and innovating. Finally, after countless days and nights of hard work, he successfully created a medical miracle of using pure Chinese medicine to treat cancer. Under the influence of his scientific research results, cancer cells are gradually reversed under the magical power of pure Chinese medicine, and step by step they are transformed into normal physiological cells, truly achieving a one-time cure and ensuring that there will be no recurrence. This achievement has caused an uproar in the medical field. Back in 2012, for Qiluan and Apo's family in Shaanxi, that was the beginning of a nightmare. Qiluan, 53 years old, the man who shoulders the burden of the family, was completely devastated by a diagnosis: cancer of the right upper lobe of the lung, metastasis of the left cervical lymph nodes, and squamous cell carcinoma. These cold medical terms, like the judgment of fate, pushed him and his family into an endless abyss of darkness. What is even more despairing is that his brothers, sisters and mother all suffered from cancer. This cruel family history made his condition worse, as if fate had already sentenced him to a suspended death sentence. Everything happened too suddenly. As early as July 2012, Qiluan had been suffering from cough and hoarseness, but the drug treatment at the local hospital was ineffective. On August 7, at the first affiliated hospital of Shaanxi Medical University, the chest CT image was like a horrifying picture, clearly outlining the cancer in the right upper lobe of the lung. Bronchoscopy, pathological analysis, every examination ruthlessly confirmed the worst result. TV-type collagen, CK5-6+, CK7+, Ki67, positive cells 60%. P63+. Behind these complex pathological data was the confirmed diagnosis of squamous cell carcinoma, posterior segment of right upper lobe, second carina. Ultrasound examination showed a solid low echo mass of approximately 1.21 by 0.71 centimeters in size in area 4 of the left neck with unclear boundaries, and multiple enlarged lymph nodes in area 6 of the bilateral neck. Cancer cells have begun to spread wildly. In order to survive, Qiluan was admitted to the Shaanxi Armed Police General Hospital. Here, he underwent the pain of gamma knife treatment and suffered the risk of low platelets. Western medicine and Chinese medicine were used one after another, but the pain still persisted. During his hospitalization, medical staff kept a close eye on his condition and adjusted the treatment plan time and time again, but they were unable to stop the deterioration of his condition. During his time in the hospital, every minute and every second was torture. The physical pain and fear of the unknown left him and his family with no hope. In the end, they had no choice but to be discharged from the hospital. Are they really forced to bow to fate? The turning point came on January 9, 2013. At his daughter and Apo's insistence, Qiluorong came to Professor Chen Hailin. At this time, he was as thin as a stick, his face was dull and lifeless, and his weight had dropped by dozens of pounds compared to before he fell ill. The coughing would not stop, and every cough seemed to tear apart his internal organs, and the blood in his sputum became more and more serious. His voice was so hoarse that he could hardly speak, and he could only express himself with his weak breath. The chest tightness and shortness of breath made it difficult for him to breathe. He would gasp for breath after walking a few steps. His shoulders felt cold and his back ached. Especially at night, the pain became more severe. He could only fall asleep while sitting up. Even lying down became a luxury. Dry mouth, anorexia, fatigue, headache and dizziness, all these symptoms tortured him to the point of being unrecognizable. When Professor Chen Hailin sees such patients, his eyes are full of heartache and determination. He carefully felt Qiluorong and Apo's pulse, which was deep, thin and smooth, like the weak yet stubbornly beating flame of life. Then, he carefully observed the patient and Apo's tongue coating. The tongue coating was red and thick, which was a distress signal sent by the body. Relying on his many years of rich clinical experience and profound theoretical knowledge of traditional Chinese medicine, Professor Chen Hailin carefully diagnosed the patient and concluded that the patient had deficiency of both lung yin and lung yin, excessive phlegm and toxicity, secret consumption of body fluids, and stagnation of qi and blood stases. In response to the patient and Apo's condition, Professor Chen Hailin began to carefully prepare a prescription. He knew very well that the selection of each medicinal ingredient was crucial. One more would be too much, and one less would be insufficient. In the end, a prescription was prescribed containing more than 20 medicinal ingredients, including lotus root nodes, Radix trichosanthus, Herbaceous agramine, white silkworm, Radix aconidium Aphiapagan japonicus, Asparagus cochinchinensis, Cordyceps sinensis, Mamordica grosvenori, Trichosanths, Fritillaria serosa, Hautuinia cordata, mulberry fruit, ginseng tail, Polygonatum odoratum, Scutellaria barbata, Lithospermum officinale, gecko, winter flower, cypress seed, hemp seed. Rhubarb, plantain, poria, Polyporus umbellatus, verbena, and licorice. This prescription is like a bright light in the darkness, carrying the hope of the whole family. Among them, lotus root nodes, Radix trichosanthus, Herbagramonii and other medicinal materials work together to nourish yin and moisten the lungs, cool blood and stop bleeding. White silkworm, Radix aconidipulex, herbatriliums and other medicinal materials focus on dispersing nodules and reducing swelling, and fighting against stubborn phlegm and toxins in the body. Aphiapagan japonicus, Asparagus cochinchinensis, Cordyceps sinensis, etc., replenish body fluids and nourish the lung yin. Eroded by the disease, ginseng tail and Polygonatum odoratum replenish qi and blood, and inject strength into a weak body. Every medicine contains the wisdom of traditional Chinese medicine, and every medicine carries the desire for life. Take 15 doses of medicine, 1 dose every 2 days, morning and evening. This seemingly simple process of taking medicine is actually a difficult battle. After taking the medicine in the first stage, miracles began to appear. The cough was relieved, the sputum and blood decreased, and the long-standing problem of dry stools was improved and became smooth. In the second stage, the chest tightness and shortness of breath gradually eased, and I could finally lie down and rest at night, no longer having to sit through the long night like before, and my appetite began to slowly recover, and I could eat some food to replenish my energy. In the third stage, my breathing became much smoother, the symptoms of coughing up blood disappeared, and the back pain no longer occurred frequently. In the fourth and fifth stages, more symptoms were overcome one by one, and various functions of the body were slowly recovering. During the entire treatment process, Professor Chen Hailin always paid close attention to the changes in Qiluorong and Apo's condition. During each follow-up visit, he would ask the patient in detail about his physical feelings, observe subtle changes in symptoms, and then make precise adjustments to the prescription based on actual conditions. Reduce rhubarb, verbena, and plantain, and add Blatilla striata, parsley, Rhizoma alba, raw tortoise shell, and turtle shell, then add Gastrodia alata, cicada shell, Oraxylum, earthworm, Scutularia bacalensis, and Scrofularia nymphoensis. Every addition, subtraction, and replacement of medicinal materials reflects Professor Chen Hailin and Apo's in-depth analysis and precise grasp of the condition, and is his effort to help patients regain their health. May 29, 2013, is a day that Qiluorong and his family will remember for the rest of their lives. An ultrasound examination at Jinzhong First People and Apo's hospital showed no enlarged lymph nodes in both necks. The CT diagnosis report also brought good news. The lung condition has improved significantly, and the previous lumps have disappeared. Subsequently, Professor Song Daking from Shaanxi Cancer Hospital reviewed the film and confirmed that the tumor disappeared after treatment, with no recurrence or metastasis. At that moment, all the tears turned into joy and all the persistence became meaningful. Qiluorong and his family were so excited that they were speechless. They held each other and Apo's hands tightly, their eyes full of longing for the future. In October 2014, multiple tests at the General Hospital of the People and Apo's Liberation Army and the Armed Police Force once again confirmed that, no tumor cells were found. From 2013 to 2023, 10 years passed quietly. Qiluorong not only got rid of his illness, but also embraced life again. He was once sentenced to death by cancer, but now he has become a witness to the miracle of traditional Chinese medicine in fighting cancer. He can help his family with housework, work in the fields, enjoy family happiness, and his face is filled with a happy smile. These 10 years have not only been Qiluorong and Apo's personal journey of rebirth, but also a powerful demonstration of Professor Chen Hailin and Apo's ability to treat cancer with traditional Chinese medicine. Professor Chen Hailin created this amazing miracle with his superb medical skills, rich experience and deep care for patients. When the wisdom of traditional Chinese medicine is perfectly combined with the examination methods of modern medicine, and when Chinese medicine experts like Professor Chen Hailin rely on their expertise and compassion to prescribe the right medicine for the human body, the miracle of life will no longer be far away. Traditional Chinese medicine, with its unique charm, has lit the light of hope for countless cancer patients and proved to the world its irreplaceable value in the medical field. In the future, more and more people will surely defeat the disease and regain new life under the care of Chinese medicine experts like Professor Chen Hailin. In the countryside of Hunan, 63-year-old Chen Pangbin was pushed into a desperate situation by a diagnosis: giant liver cancer. The tumor diameter reached 158 mm x 127 mm, and the portal vein cancer thrombus was entrenched. Even experts from authoritative institutions such as Xianya Hospital and Hunan Cancer Hospital shook their heads and sighed, and quote, "The platelet count is too low, immunotherapy is impossible, and the survival period is only 3 to 5 months." End quote. When the light of modern medicine is dim, a Chinese medicine doctor has torn a crack of hope for life with his skillful hands and benevolent heart. Late at night on November 18, 2021, Chen Pangbin and Apo's daughter sent a WeChat call for help in despair. At that time, the old man was lying in bed groaning. The right liver area was in severe pain like a knife, the abdomen was swollen like a drum, the face was sallow, and even basic diet became a torment. The examination reports from many hospitals were shocking. The liver volume was crazy enlarged, the huge mass pressed the organs, the portal vein was eroded by the cancer thrombus, the spleen was enlarged, and the left kidney stone was like adding insult to injury. What is even more worrying is that he not only has old diseases such as hepatitis B and rheumatism, but also has become emaciated due to long-term pain and torture, and his vital signs are in danger. When Professor Chen Hailin received the news, he immediately realized that this was a race against death. He studied the medical records overnight and observed the patient and Apo's tongue coating and pulse through video consultation. The dry and cracked tongue surface was covered with thick and greasy coating, and the pulse was slow and stringy, a typical symptom of liver stagnation, qi stagnation, and internal dampness and toxicity. End quote. We must start with soothing the liver, strengthening the spleen, and detoxification. End quote. Professor Chen quickly prescribed a prescription with astragalus to replenish qi and consolidate the foundation, lobelia and artemisia capillaris to clear heat and detoxify, duchesnia and seaweed to soften and disperse nodules, and qianlong and buffalo horns to directly attack the lesions, combined with agarwood and woollinger to promote qi and relieve pain. This prescription, which embodies the wisdom of traditional Chinese medicine, became the patient and Apo's last life-saving talisman. After taking the medicine for 20 days, miracles began to appear. Chen Pangbin and Apo's liver pain was significantly relieved, his swollen abdomen began to subside, his urine gradually became clear, and his appetite also recovered. According to the changes in symptoms, Professor Chen Hailin cleverly adjusted the prescription, adding aromatic herbs such as green peel and costus root to enhance the power of dredging the qi mechanism. Then he combined chicken gold and codonopsis to replenish qi and blood and improve sleep. The increase and decrease of each dose of medicine is as precise as dancing on the tip of a knife, which not only encircles and suppresses cancer cells, but also protects the patient and Apo's weak righteousness. 8 months of persistence have brought about shocking changes. On June 27, 2022, the CT report of Pingjiang County First People and Apo's hospital showed that the giant tumor that was once 158 mm x 127 mm had shrunk to 22 mm x 50 mm. The results of the re-examination on February 2, 2023 were even more amazing. The tumor continued to shrink, some areas had calcified, and various body indicators tended to stabilize. From being bedridden to being able to walk and do housework, Chen Pangbin witnessed the magical power of Chinese medicine in, breaking the whole into parts, with his own experience. Chen Pangbin and Apo's case is not only the rebirth of a family, but also a milestone in Chinese medicine and Apo's efforts to overcome severe diseases. It breaks the inherent perception that late-stage cancer cannot be cured by medicine, and proves that the combination of ancient Chinese medicine wisdom and modern medicine can completely create miracles of life. And Professor Chen Hailin, a persistent explorer of Chinese medicine, is still ferrying the lives of more patients, writing a magnificent epic of fighting against the disease with a prescription. Scaffolding of Life, a 13-year battle between a construction worker and lung cancer. One summer day in 2009, Liu Haixue, a 57-year-old construction worker in Changji, Shaanxi, suddenly coughed violently while working at a height, and a mouthful of blood stained his gloves red. The CT images showed that both lungs were covered with scattered nodules, like a dense haze, lung cancer, and had metastasized to multiple places in the upper lobes of both lungs and the lower lobe of the left lung. The advice of Shaanxi Coal Hospital was like falling into an ice cave, and go home for radiotherapy and chemotherapy. On the spiral CT report of Changji People and Apo's hospital, the maximum diameter of the nodules with rough edges reached 15 mm. As a fellow villager, the director of the radiology department reluctantly told the family, radiotherapy and chemotherapy can only last for 8 months at most, and most people can and Apo's make it to that time. After going through many hospitals, they all got similar desperate answers. 2 months of running around and asking around not only exhausted hope, but also made the condition worse. In November 2009, the CT of the Peace Hospital affiliated to Changji Medical College once again confirmed multiple nodules, thickening of the pleura, and enlargement of mediastinal lymph nodes, and the countdown of life became more and more rapid. When I first met Professor Chen Hailin, Liu Haixue had become extremely thin. He coughed up blood and felt chest tightness as if a huge rock was pressing on him. He couldn't and Apo's sleep at night because of difficulty breathing. His night sweat soaked his bedding. Ulcerative gastritis made him unable to eat. His tongue was mottled like a map, his tongue coating was thick and greasy, and his pulse was thin and stringy, typical symptoms of qi stagnation, blood stasis, and phlegm and poison in the lungs. Professor Chen looked at this construction worker who was tortured by illness and wrote down a prescription: use Hautuinia cordata and Scutularia barbata to clear away heat and detoxify and eliminate lung nodules, use crane herb and lotus root to cool blood and stop bleeding, and relieve hemoptysis. Use astragalus and codonopsis to strengthen the body and resist the crisis that cannot be reversed by radiotherapy and chemotherapy. In September 2009, pure Chinese medicine treatment was officially introduced. After 7 months of persistence, miracles quietly grew. Liu Haishou and Apo's cough gradually subsided, and he was finally able to sleep peacefully at night. The symptoms of blood in his sputum disappeared, and his appetite gradually recovered. The re-examination results were encouraging. The lung nodules were smaller than before, and his physical condition improved significantly. He resolutely stopped taking medicine, picked up the tile knife again, and returned to the familiar construction site. On November 3, 2010, the CT report of the Heji Hospital affiliated to Changji Medical College captured this turning point. The lesions that once threatened his life have been effectively controlled. In the 13 years since then, Liu Haishou has never stepped into the hospital again, but has always been active on the construction site. During the follow-up during the Spring Festival in 2022, the elderly man in his 70s was still in high spirits, building houses with his calloused hands and also building miracles of life. From being sentenced to not live more than 8 months to working healthily for 13 years, Liu Haishou and Apo's story is a vivid footnote to the concept of strengthening the body and eliminating evil in traditional Chinese medicine. Professor Chen Hailin used traditional Chinese medicine as bricks and medical theory as beams to build a solid fortress for patients to resist diseases, and proved that, on the scaffolding of life, the wisdom of traditional Chinese medicine can also support a blue sky. 30 Years of Life Answers, a silent battle between traditional Chinese medicine and esophageal tumors. In 1992, Wu Junjie, an engineer at Shaanxi Qinji Group, was shocked by a pathology report, papilloma, in the middle of the esophagus, and the hospital decisively recommended surgical resection. Facing the cold scalpel, the 53-year-old intellectual chose to turn around and embark on a path of traditional Chinese medicine full of unknowns. At that time, Wu Junjie had been tortured by illness for several months. From the initial sore throat and slow swallowing to the dull pain in the sternum and soreness in the back, every meal became a torment. At night, the mouth was dry and the tongue was burning, and it was difficult to sleep. During the day, I was weak and tired, and even the simple swallowing action was accompanied by tingling. After trying Chinese medicine conditioning in many hospitals without success, his condition took a sharp turn for the worse during the drug withdrawal period. On August 20, 1992, he was described as thin, holding a note full of symptoms, and found Chen Hailin, a traditional Chinese medicine expert. Chen Hailin examined the patient and Apo's yellow tongue with thick and greasy coating and fine pulse. Combining the symptoms, he diagnosed the patient as phlegm, blood stasis, qi stagnation, fluid deficiency, and toxic accumulation. In his eyes, this seemingly benign tumor is actually an external manifestation of the imbalance of qi, blood, and body fluid in the body. In addition to clearing away heat and resolving phlegm, regulating qi and dispersing stagnation, it is also necessary to replenish body fluids and harmonize the spleen and stomach from the root. In the prescription, trichosanths and Fritillaria serosa resolve phlegm and dissipate stagnation, unblocking esophageal congestion. Arphiapagan japonicus and Polygonatum odoratum nourishing and moisten dryness, relieving dryness in the mouth and tongue, astragalus and atractylodes. Macrocephalus strengthen the spleen and stomach, injecting vitality into the weak body. The combination of each medicinal material implies the wisdom of treating the disease from the root in traditional Chinese medicine. After 4 months of continuous conditioning, Wujunjia and Apo's symptoms melted like ice and snow, swallowing gradually became smooth, sternum pain disappeared, and sleep and appetite returned to normal. On January 4, 1993, the fiber gastroscopy examination at Shaanxi Provincial People and Apo's Hospital was exciting. The papilloma that had once existed was completely gone, leaving only mild esophagitis and chronic superficial gastritis. What and Apo's even more amazing is that this miracle of recovery lasted for 30 years. In the multiple follow-ups in 2013 and 2022, Wujunjia, who was over 80 years old, was still in good spirits and enjoying a healthy old age. In the field of tumor treatment where surgery is the mainstream in modern medicine, Wujunjia and Apo's case is like a heavy hammer, ringing the strong tone of conservative treatment of traditional Chinese medicine. Professor Chen Hailin used traditional Chinese medicine as a pen to outline the trajectory of recovery between the blood vessels of the human body, and used 30 years of time to prove that without the need for swords, the holistic conditioning of traditional Chinese medicine can also clear tumors and write an answer sheet for life that exceeds expectations. Rebirth from the cocoon, traditional Chinese medicine lights up the light of life for patients with malignant lymphoma. In 2018, a cytopathological diagnosis report from Shanghai Fudan University Cancer Hospital plunged 48-year-old Qiu Zhengli from Ninghai, Ningbo, Zhejiang into the abyss. The dense lymphocytes in the pathological mass puncture picture foreshadowed the shadow of malignant tumors in the lymphatic hematopoietic system. Faced with such a result, fear and despair instantly enveloped her and her family. Introduced by a friend working in Hangzhou, Qiu Zhengli traveled thousands of miles to Dr. Chen and Apo's clinic in Lucheng, Shaanxi on September 16, 2018. At that time, the 68 mm mass in her body was like her entrenched and tumor, which not only seriously affected her daily life, but also threatened her life and health at all times. After a detailed diagnosis, Dr. Chen decided to adopt a pure traditional Chinese medicine plan of oral and external biphasic treatment. The Chinese medicine prescriptions for internal use carefully select medicinal materials with the effects of softening and dispersing nodules, strengthening the body and eliminating evil, regulating the body and Apo's qi and blood from the inside, enhancing the body and Apo's immunity, and fighting cancer cells. The Chinese medicine ointment for external application directly acts on the tumor site, and penetrates with the power of the medicine to try to dissipate the tumor. This two-pronged treatment method, both internal and external, embodies the unique wisdom and experience of traditional Chinese medicine. In the more than 10 months of clinical treatment, every dose of Chinese medicine and every application of medicine carried Qiu Zhengli and Apo's desire for life. As time went by, miracles happened quietly. The originally huge 68 mm tumor gradually shrank until it disappeared completely. Qiu Zhengli and Apo's physical condition is getting better and better, and the haze that was once tortured by illness has been swept away. On October 21, 2019, the fine needle aspiration cytology pathology diagnosis results of the Ningbo Clinical Pathology Diagnosis Center drew a staged and successful conclusion to this fight against the disease. The report showed that only scattered lymphocytes were found in the smear, and no tumor evidence was found. This means that the malignant lymphoma that has troubled Qiu Zhengli for a long time has been effectively controlled or even eliminated. In the 3 years since she stopped taking the medicine, Qiu Zhengli and Apo's condition has not metastasized or recurred, truly achieving a one-time zero. During the follow-up during the Spring Festival this year, she was in good health and her life returned to normal. From being shrouded in the shadow of malignant lymphoma to regaining a new life, traditional Chinese medicine, with its unique treatment methods and magical effects, has dispelled the darkness for Qiu Zhengli and lit up the light of hope in life, and once again proved to the world the powerful power of traditional medicine in fighting major diseases.